PATH stands for Personal Action Towards Health. It's what we call the Chronic Disease Self-Management Program in the state of Michigan. It means taking a more active role in your health and feeling empowered to take charge. An example would be being able to manage the day-to-day requirements that living with a chronic health condition requires. Things like maintaining a healthy diet, increasing physical activity, managing your medications, following through with and working really as a team member with your doctors and nurses. Patients and caregivers can participate in the workshop. Because it is an evidence-based program, it's utilized all over the world to help people in the community with a variety of health conditions manage their health. It brings together a group of people that all have kidney disease or have been impacted by kidney disease, and they get to learn from each other and hear from each other. The 6-week workshop covers topics anything from healthy eating, physical activity, working with your healthcare team, and it also covers different self-management tools that are useful when managing a chronic health condition. Things like action planning, creating short-term goals that help someone achieve a much larger goal, and also problem solving. That's really when they get input from their fellow participants. The sessions are 2.5 hours each, once a week for 6 weeks. I think that having the opportunity to interact with other patients, to take time out to learn and reflect on one's own goals is really powerful, and we don't often get that opportunity.
I didn't know what to expect, actually. To actually see things on paper, to create an action plan, to have tools from a toolbox to use to help cope and deal with situations. I think that was, I've never thought of it like that, but it helped me a lot. Action plans are things that we come up with on our own that are viable goals that we can reach short term. At the end of each session, we would all discuss our action plans and we would all know what each other's action plan were, and we were encouraged to give each other a call, see how we're all going through with it. And if we needed help, or if one of us had struggles, the other would encourage the other. Because next week we're going to have this conversation all over again. About did you complete your goals, and how if we had struggles and how we overcame them. Time I was struggling, and one of my co-participants, they were going through the same thing. You been walking today, or did you go out for a walk today? Well, let's go walk today. You don't have to do it alone. There's always someone that you can talk to.
It is a self-management program for chronic disease. I was approved in July of 2013 to get on the transplant list, and I'm still active on the kidney transplant list. I just decided to roll the dice and take this program, and as it turned out, it was probably one of the best experiences in all my 64 years. It was really cool. Every week there was just something new going on, a new idea. Action plans were a big part of it. You were given an assignment every week, and you had to come back the first thing at the next class and report on whatever you signed up to do, whatever goal you decided I was going to do. When you're sitting in a room with 12 people that have pretty much the same condition that you have, you get real motivated. The PATH program really gave me a road to get better. I know it's for people with chronic diseases and stuff like that, but it's just a good overall program for anybody that's got any health issues whatsoever.